Welcome to another episode of our Wellness Exchange series. My name is Yvonne T with the Hidalgo County Wellness Program, and today we have the pleasure of having Dr. Yvonne Quintanilla to discuss mental health. Dr. Quintanilla, thank you so much for joining us today.
Thank you for having me. It's really exciting to be back again.
Thank you so much. Well, to start off, can you please give us a general information of what is mental health and why it's so important?
When we're talking about mental health, we're talking about a couple of things. It is comprised of three things: the emotional piece of it, the psychological piece, and then our social well-being. We have to remember that all three of those help us figure out how to act, how to think, and how to cope with everyday stress. So that's what we're talking about when we're talking about mental health illnesses.
And right now with the pandemic and everything that we have gone through this past year, definitely we have seen an increase in maybe cases with patients that have been diagnosed with a mental health. Would you elaborate a little bit more of what you have seen with this COVID-19 pandemic?
The majority of the cases that we have seen are things having to do with anxiety, stress, because we've isolated ourselves from our family and our friends. It's been a challenge for people because they're learning to trust again, to be able to go out to a restaurant, to be able to just go outside into the community, go to a grocery store. Those are all things that we're having to readjust to. Definitely. So those are some of the things that we're seeing. We're also seeing a lot of depression, different kinds of depression. And a lot of it is due to just flat out being isolated for so long and being away from family and friends. You're seeing that with the elderly, you're seeing stress and anxiety with the children that are at home, learning to use the computers, getting frustrated because the internet's not working to do their schoolwork. The parents are having to teach that have never taught before, and they're sitting there pulling their hair out, trying to figure out, how do I do this? Oh my gosh. So there's a lot of changes, a lot of adjustment changes that we've seen due to COVID.
Definitely, and as you mentioned before, we are social, so mental health is part of that social well-being, and we need those connections and those social interactions to actually have a balanced mental health. So definitely,
yes,
it's very different. Would you be able to elaborate a little bit more on what are some of the risk factors for mental health?
There's different things. For example, if there's a family history, child abuse, neglect. We've had a lot of folks that are experiencing financial stress due to being unemployed, things like that. But then you also have the homeless, okay? You have those things. You also have drugs and, of course, alcoholism. A lot of folks that stayed in house, you've seen more alcoholism due to that. But it's not just COVID that we're talking about. Remember, we just had a hurricane. We just had a winter storm, and we were hit like 1, 2, 3. We never had a chance to catch our breath, right? So because of that, you're being hit with one layer of problems and then another layer of problems, and it's mounting. And it's sometimes when you have an illness like that, they get worse if they don't get treated.
Very important that you mention all these situations that are happening to, for example, here in the Rio Grande Valley, that we have been affected, and maybe we don't think that they affect us directly, other than the physical, right? Maybe, of course, there's a lot of effects physically, but also mentally, they do take a toll on us, and I can understand how the hurricane and the pandemic and all of that has definitely taken a lot of energy from the people. So.
Yes, they have.
Well, one of the main questions that I wanted to ask you, Dr. Quintanilla, was mental health conditions, are they preventable?
That's one of the questions that I get asked often, and I want to point out that it is treatable.
Okay.
It is treatable, but it's important to find a doctor or a therapist that can help you create a treatment plan. But here's the thing. We therapists, the doctors, we can put you on a treatment plan, but you've got to do the work. In order for us to help you with the recovery process, it has to be where you're going to follow the treatment plan. It's like when a doctor gives you medicine. You have, I don't know, an infection. The doctor gives you, penicillin, whatever it is. And he tells you, make sure that you take it, at this time, this many times a day. You need to do that to help get you healthy. Same thing with mental health. You need to do the steps to be able to go through the recovery process. That's how it's going to work.
Definitely. So it does take an active part from the patient, yes, to actually be able to manage those conditions. And would you be able to explain a little bit more? And I know we have had a previous presentations on mental health before, but what are some of the different types of mental health conditions that there are?
Oh, there's several of them. There's anxiety disorder. There's postpartum depression. Mm-hmm. That's also known as, there's 3 pieces of the postpartum depression. I know we're going to talk about that later. Mm-hmm. There's also post-traumatic stress. That's mm-hmm. also known as PTSD. Okay, we have obsessive compulsive disorder. That's OCD. Mm-hmm. Then there's depression itself. Then there's bipolar personality, disorder. There's several different ones. There's schizophrenia. There's psychosis. There's several mental health conditions like that.
And what about eating disorders?
Eating disorders is one of them as well. Yes, correct. Mm-hmm.
So we have discussed of the different mental health conditions that there are, and there's definitely a great variety and diverse different mental health conditions, different aspects. Is there some of those mental health conditions that a patient should aim to handle themselves, or would you recommend always to seek medical treatment for those conditions?
Okay, whenever, someone is experiencing maybe 1, maybe 2 signs, don't panic. It just means that your work-life balance has altered somehow. You see, if you think about it, we should have balance in our life. One of the things that I do with my clients that I see is the first thing that we do is we sit and we think, okay, first of all, let's divide things out. What am I doing for my body? Today, what am I doing to keep my body healthy? We have to understand that we get one body in our lifetime, right? What are we doing to maintain it? And then our mind, what are we doing to keep our mind active? Mm-hmm. That's our mind. What are we doing to help us keep it sharp, to keep those receptors going, mm-hmm. And then the other piece is the spirituality. It doesn't necessarily mean religion, but we're talking about spirituality in general, like meditation. Are you meditating? Are you bringing harmony and peace and happiness into your life? Are you surrounding yourself by good and positive people? Those are some of the things that are important and crucial. But again, if you find that you feel a little off, maybe it's extreme anxiety, stress, but this has been happening for not just today, but maybe for several days or a week or 2, then it's very crucial that you go on and you see a doctor or a mental health therapist that'll help you create a treatment plan or help you identify where you're at, and then help you with learning to manage if it's depression, anxiety, those kinds of things. Because sometimes we ourselves don't really know what it is we have to do and we panic. And that's what we don't want. We don't want anxiety to become panic attacks. Yes. We don't want depression to become something severe. So it's about seeking help, just getting the help that you need when you need it, and understanding that it's okay to ask for help.
Yes, definitely. And one of the things that you mentioned is that those symptoms or those feelings are normal, right? Yes. We are human, so it's okay for us to be sad sometimes. It's okay for us to feel stressed, but when it's a prolonged time, that's when we definitely need to start
seeking help. When you realize, okay, something's off, that's when you need to start looking for the help.
So Judith mentioned about this long or prolonged time of feeling this, but what are some of the signs that we can probably observe when there's potentially a mental health condition?
Well, there's a couple of them. For example, if you have changes in your sleeping or your appetite, you know we're supposed to be sleeping a good 6 to 7 hours. Are you doing that? One of the questions that I usually ask our clients is, okay, I need to know about your sleeping. Tell me, when you lay down and close your eyes, can you easily fall into sleep slowly? Or are you sitting there and your mind is just going and going and going and you can't make it stop? Or you're sleeping and then you wake up and you just can't go back to sleep because you're worried about this, thinking about that. So those are some of the things. But remember, is this happening more than once? You know, is it happening like all week long? Then you've got to do so. Appetite is the same thing, okay? Other things would be a decline in personal care, or you stop like washing your face, something as simple as brushing your teeth. Some people that are really, really struggling with these conditions, they have a difficult time just getting out of bed. They feel very lethargic, fatigue, and it's not just one time, it's several days. In some cases, it's several weeks, and they don't shower, those kinds of things. And then there's mood changes. Mood changes could be anything from all of a sudden you're happy, you're sad, and then boom, you're angry and screaming, but then you go back to, I'm so sorry, and you know, those erratic, rapid mood changes. That's a big indicator as well. That means that, you know, something is affecting you. It could be stress, anxiety, whatever the case may be. What about also sensitivity, like to smells, to the light, to touch? Those are also warning signs. And then, of course, apathy, where you feel like you don't have the energy to do the things you used to love. Maybe you used to love to play the guitar and you just put it away, you don't want to see it anymore. Or maybe you used to love to paint, you stop doing that. When you've lost interest in the things that you used to do. And then nervousness is a big one. Nervousness can be paralyzing. It's the fear that it just kind of strangles you and it keeps you from moving forward. Those are some of the warning signs, and there's others, but those are just a few of the warning signs.
Okay, Doctor, and going back to the appetite, would you say that it's an increase of appetite and reduce of appetite? Are both
It can work either way. There are people that will eat their feelings, I'm sure you've heard that, and there are people that are so nervous and so stressed, they just won't eat because they get nauseous or whatever the case may be. But it can go either way. You'll see a significant weight loss or a significant weight gain.
Wow, very interesting. And of course, those are things that we can definitely look out not only for ourselves, but also if we have children or partners, everybody. And I think definitely we do need to take care of each other, and hopefully having that knowledge of what are those warning signs can help.
In children, a real good warning sign, because I've worked with adolescents, is when you notice that they start isolating themselves, or the grades start dropping, or all of a sudden they quit football. You know, things like that are warning signs. And then there's alcohol and drug abuse as well.
Do you have any recommendations, for example, now that we're talking about children, for parents that potentially are seeing some of these warning signs in their children? What would you recommend for them?
One of the things that we always tell the parents is that if they're seeing these things, you know, have an open and honest conversation with them. You know, sit with them and talk to them and find out what's going on. Watch them. Watch who they're hanging out with. Did they change their friends? You know, are you seeing, check with the schools. Are they actually going to class? Are they skipping class? There's lots of little things that you can do. You can talk to the school counselor to help you figure out what's going on, to do observations. You know, those are some of the things that you can do. Talk to their friends. You know, always know who they're hanging out with.
Definitely.
You know, those are important things to do. And then once you see that there are changes in their life, take them to a doctor. And a doctor can help you. Or look for a therapist that can help you find out what's going on. But it's not just for you, but it's to help them function, because there was a change in their life that caused these things. And maybe they don't know how to manage it. Maybe they're being bullied and they don't know what to do. Maybe they failed a class and they just gave up, you know, whatever it is. And maybe they're not ready to open up to you, but a lot of them feel comfortable opening up to a therapist or a doctor because they're a stranger. And those people are not going to judge them or criticize them.
Yes, and there's no, also potentially sometimes children might feel that they are being only attacked, or they are not being understood, or something like that. So definitely having a third person unbiased can definitely help solve the situation. And you did talk a little bit about bullying, and we know that we do have a situation, an issue here in general in all the United States and potentially all around the world. But do you have any recommendations for people that may have been suffering from bullying, or that maybe in the past they did, and even though they might be currently okay or they feel well, they might still have some work to do regarding the bullying
When I work with school children, and I do come across a bullying case, one of the things that we do is I do the best that I can to pull the information out of them. It's very difficult sometimes because they're scared, you know, that it's going to come back, or that someone's going to find out, or that they're going to get hurt again. I can tell you that when I was a school counselor, I remember working with the children that were bullied, and I would work with the teachers, and I would work with the principals just to help, you know, manage that and to help them be able to function. And then one of the things that we always did is we worked with the victim, the bullied person, and basically worked on assertive tips, you know, and building up their self-esteem so that they no longer felt like a victim. So those, teaching them how to cope, yes, but teaching them to be assertive, not aggressive, to be assertive is another step in helping build their self-esteem and to help them, you know, get past this.
And have the right tools to actually confront the situation and maybe even put an end to it.
Yes.
Well, that's a really interesting point, and I haven't thought about that. So definitely giving them the tools, not only coping, like you mentioned, is definitely something really important. And I know that, for example, when someone in the family is experiencing maybe a mental health condition, it also takes a toll on the family members. I don't know if you can elaborate a little bit more on how their family members can also support them or can also receive support when they are helping a family member with a mental health condition.
I'm going to use this as an example. When I was helping out at the hospitals during COVID, one of the things that I found, because I was working with COVID patients, yes, but I was also working with just different mental health conditions. And one of the things that I always felt was really important is it's really important to offer support, you know, as family members, to if you see that someone in your life is in crisis, maybe not necessarily in crisis, but maybe they're going through, you're seeing like certain signs or symptoms like the ones that we discussed earlier. If you see some of those things, those are what we call red flags. So one of the things that we always tell family members is to remember to offer support and to encourage them to go see a doctor, to go see a therapist. Maybe they don't know where to start. Help them find a therapist. Some of these folks have a job and they have an EAP program, which is an employee assistance program. They don't even know that that's their counseling service. So if they reach out to a therapist that way, that would be great. If not, a doctor, when you go to a doctor, the doctor, you can ask them, can you connect me to some of these resources? Can you tell me where I can find a therapist, where you would recommend? Those kinds of things. So offering that kind of support, encouraging them. Also, maybe they're already on a treatment plan. If they are, you can support them by checking on them. Hey, are you taking your medication? Do you need any help with any of that medication? Maybe I need to go pick it up from the pharmacy.
Or
yeah, those kinds of things. Or maybe you can even get the little pill box, separate it, you know, like that for them. Find little ways to help them, to show them that you're there for them. Another way is to help them figure out how to make an appointment with a therapist. Go with them, drive them there, just to help show them that you're there. You are, if they need you, you will be there. And that will motivate them to want to continue with their treatment plan.
Dr. Quintanilla, would you be able to elaborate a little bit on what are some lifestyle changes that someone can do to have a well-balanced life? You did mention before how we need to take care of our body, our mind, and our spirit. Would you be able to elaborate a little bit more on what we can do?
Well, one of the things that I do when I work with some of my clients is I'll go and I'll have them make a list, and they're charting and they're logging. And one of the things that I'm asking them is, what are you doing now? For example, for your body. What are you doing right now? Okay, I can ask you, what are you doing right now for your body? Like I mentioned earlier to you, we have one body. What are you doing to maintain it? Are you eating the right foods? Are you drinking plenty of water? That's very important, believe it or not, okay? Are you exercising your body? Are you taking it for walks? Are you doing things to maintain it? Are you taking care of your skin? You know, those little things. Something as simple as getting a manicure and a pedicure for a female. For a man, it's basically exercising it and just taking care of the body. The muscle tensions, all those things. So if I were to ask you, what are you doing now? Could you tell me 5 things that you're doing right now to maintain your body? And then we can go on and we talk about your mind. Our mind is very important. If you remember, it's almost like our battery, okay? The receptors in our mind need to be constantly activated. If you go and you look, of the brain of a depressed person, there's some really dark black spaces. That's where all the sadness and depression is sitting, which means that the receptors are not being activated. But then you see the brain of a person that's pretty active, you see a lot of electricity. That means that it's active, it's working. So what are the things that you're doing to keep it sharp? You could do anything as simple as learning a new language. See, that's challenging the mind. Reading books, learning to play an instrument, listening to certain types of music that has certain beats. That helps keep the receptors moving. Just having new and healthy experiences, very simple things, but it's about helping with that. Remember, that helps with dementia, that helps with Alzheimer's, Sudoku, all those little things, keeping the mind sharp. It could be as simple as doing, learning how to do pottery, art, those kinds of things, because what you're doing is you're challenging the brain. Remember, we have the left brain and then we have the right brain, and they need to work together to keep them sharp. But something else that's really important, when you are working on your body, like let's say you're going for a walk, okay? You're going for a walk, you're breathing in the fresh air, you're bringing in oxygen to your brain. It's clearing out the muddiness, you know, that brain fog feeling that you have sometimes. Those are some of the things that help. So again, the mind and the body, but then we have another piece of us, the spirituality piece of us. The spirituality piece of us, when we're looking at that, you have to look at it not just as religion, but you need to look at the other pieces of it. For example, what are you doing to bring harmony into your life? When you walk into your home, the moment you step into your home, that's your sanctuary. That's when you walk in there, you get that, I'm home. You've left all that other stuff behind, because you're home. You've walked in, and when you walk into your home, you expect peace. That's the place you feel safe. That's the place that your dog runs to you and is excited to see you. The kids run to you, mom, you're home. That's your place of harmony. That's where you have a Zen life, right? So the question is, what are you doing to maintain that spiritual side of you? Are you taking moments, that quiet time, to meditate? And by that, I'm talking about grounding yourself. Sometimes life happens and there's a lot of stress and anxiety, bills, all these environmental factors are affecting you, right? So what's happening is you kind of lose yourself in that little tornado of life, right? You have to get yourself out of it, you know, and once you get out of it, then you sit there and you think, oh my gosh, there's so much to do. So that's where you have to find balance in your life, and you have to ask yourself, what am I doing to bring peace in my life? It could be as simple as sitting outside and just enjoying your garden. You could be gardening. See, those are the moments where you're sitting there and you're doing something that you enjoy. It could be as simple as taking a bicycle ride, swimming. But what it is, it's a moment where you're spending by yourself to learn to value yourself and to appreciate yourself, because then you can bring joy into your life. And see, and that's where you understand that you're the only one that's responsible for your own happiness. You cannot depend on other people to make you happy. No, ma'am. It's about you learning to be responsible for your own happiness, because this is your life. What are you doing to keep that balance in your spiritual side? And then it's learning to balance all three. One of the things that an exercise that I do with my clients is I have them document where they're at. And when they start doing it, they start seeing the gaps. Oh my gosh, I'm not doing anything here. Oh no, I never thought about this. I never even thought about spirituality. I'm too busy. That's where they're learning that there's something missing in their life. So to improve your lifestyle is to learning to appreciate yourself and to learn how to find balance in all of those, so that you can function and manage, you know, these, well,
situations. And I love how you mentioned about when you arrive to your house, and hopefully you feel that sense of peace, of a place where you can actually relax and enjoy being there, not feel any kind of stress or anything. So I think sometimes it's easy for us to get busy with life, like you mentioned. There's so many things to do, so many payments that we have to do, and all of these responsibilities that we have, that when we go back home, it's more like I have more work to do at home. But definitely that's something that we need to adjust a little bit, so that they also feel that peace in their house as well.
Right, but even when you get home, yes, you know, you get home and you think, oh, I still have to do laundry, I have to do this, I have to do that. But that's okay. It's your home.
Definitely.
It's a life that you've created for yourself. And learning to balance all those different tasks, it's okay. You'll function it. Create, okay, Saturday's my laundry day. Okay, so I know. If you've got kids that are under 10 or something like that, I mean, I know I have a daughter, and I taught her to start laundry when she was 8 and 9 years old, because I thought it was a trait that she needed to learn how to do on her own. And she, thank goodness, she never ruined the clothes, but you know, those are some of the things that, these are skills that we can teach our others.
Definitely.
Something as simple as and giving the kids chores. It's your turn to do, you know, make a calendar. It's your turn to take the dishes out of the dishwasher tonight. Okay, it's your turn to wash the dishes. That kind of thing. You're teaching them life skills. Why don't you come and help me make dinner tonight? We're making spaghetti. Okay, how much, you know, do we need of this sauce or whatever? That kind of thing. Serving the food, or even setting up the table. These are life skills that you're teaching them. They're responsibilities that you're teaching them as well, that can help you with the life stresses.
And it also gives an opportunity to spend time together and communicate and continue that conversation with the family members. One of the things that I really like is that that you mentioned is that it's your home. So it's just a matter of perspective, and I think you probably have something to add to that, but it's just how we see things, how we perceive things that can definitely make a difference in our life and how we live our everyday life, right?
Correct.
Definitely. I wanted to go back to one of the points that you mentioned about how we are responsible of our own emotions and our own feelings. And you particularly talk about happiness, but I would like to know if that also, and my belief is that it does go to all the different emotions. So it's not like you make me upset or you made me unhappy or you made me happy. We are responsible for emotions, and there are some triggers and there, like you mentioned, but at the end, it's our choice on how do we respond. I don't know if you can elaborate a little bit more on that, Doctor.
When I work with some of my clients, I find that a lot of clients have very difficulty expressing their emotions. They have a lot of difficulty with that. And a lot of them tell me that they almost feel like they were never allowed to have feelings. And when I help them process whatever trigger that is affecting them, one of the things that I feel I have to continuously reassure them is that, did you know that you're allowed to cry? Did you know you're allowed to be sad? Did you know that it's okay to be angry? It's okay to be hurt? See, these are feelings that a lot of people suppress, and they don't know that it's okay to release them, okay? And it's okay to say, you hurt me, and this is how I feel. Some people are afraid to say that. And it's because either one, they were never taught, two, fear paralyzed them. They don't want to, rock the boat kind of thing. It could be a multiple reasons, but those are usually some of the things that I hear from the clients. But understanding that it's okay to have an emotion is the first step. Once you take that step, it releases a lot of tension, a lot of anger, a lot of stuff that has been suppressed in there. And after a while, it's not healthy for you. It can cause all kinds of physical issues for you, fibromyalgia, ulcers, all muscle tension, migraines. It can cause all kinds of problems like that. So understanding that it's okay for you to have emotions, and then is the first step. And then the second step would be to learn how to process those emotions. And a therapist can help you with that. And they will help you process the emotions and help you learn how to release some of that.
Express
because
them as
it's
well.
like carrying all these little, I call them monkeys, I tell my clients, okay, is that your monkey? And they sit there and they think, okay, no, what I'm talking about is that your problem. If this problem comes at you, are you taking on that problem even though it wasn't your problem? Why are you going to carry that monkey? He's going to sit there and just like this whole time bring you down, affect your self-esteem, just affect you tremendously. And then after a while, a lot of little problems on your back, they weigh you down big time. And that's not healthy. It's understanding when it's your problem, you take on that problem, you figure out how to work it, you learn to manage it, and then you release it, you take care of it. But when it's not your problem, you're carrying around somebody else's problem. And that's not yours to have. You need to give it back.
Definitely. And also, it's out of the control most of the times. If it's not your problem, probably there's not much that you can do at that particular situation. So we do need to let those things go to just reduce the level of stress, because we already, like we have discussed during our conversation, life is already difficult and challenging. Definitely. So
another big piece to all of this is learning how to forgive. That's a big step for a lot of people, is learning to forgive, because some people are so angry and so bitter they cannot forgive. But see, when you don't forgive, you're still carrying that weight. I can't tell you when to forgive. I can't say by tomorrow you'll forgive. I can't give you a time limit. You're the only one. that knows when you're ready to actually forgive and let go. And when you do, it's like something is lifted off your shoulders. It's a different feeling that you get.
A relief. Dr. Quintanilla, thank you so much for joining us today. It has been a pleasure talking to you and discussing this important topic that we definitely know that we need to continue creating that awareness regarding mental health. So thank you so much for joining us.
Thank you for having us, and I just want to emphasize that if there's anyone out there that's feeling any of these signs or any of these symptoms, please please get help, okay? Just go to your family doctor or go look for a therapist. And if you don't know who a good therapist is, ask your doctor to help connect you with a therapist and see if you can reach out to a therapist and help you process whatever warning signs or whatever symptoms you're experiencing, just to give you some mental health peace.
Yes, and the support, definitely.
Yes.
Always seeking the professional support
Yes.
is what is better, right? Well, thank you so much, everybody, for watching. Thank you for joining us in this conversation about mental health. If you want to learn more about these health and wellness topics, I invite you to subscribe to our Hidalgo County Wellness Program channel and continue to watching our Wellness Exchange series. Thank you and have a great day. Stay healthy and stay safe. Thank you.